In this video, I will discuss the sphenoid bone in detail. Sphenoid bone is an unpaired cranial bone located in the midline of the skull posterior to the ethmoid bone. The sphenoid bone is also a pneumatic bone as it contains air sinuses called the sphenoidal air sinuses. Sphenoid bone has contribution in making the floor of the anterior cranial fossa and the middle cranial fossa. This is the floor of the anterior cranial fossa, and this green is the sphenoid bone. And as you can see, it has contribution in making the floor of the anterior cranial fossa. Same, this hole is the middle cranial fossa, and this green is the sphenoid bone contributing to the floor of the middle cranial fossa. This is the anterior view of the sphenoid bone, the lateral view of the sphenoid bone, the posterior view of the sphenoid bone, the inferior view of the sphenoid bone, and the superior view of the sphenoid bone. For the better understanding of the sphenoid bone, we divide it into a body, two lesser wings, two greater wings, and the two pterygoid processes. First, we will discuss the body of the sphenoid bone. The body of the sphenoid bone is cuboidal in shape and it has 6 surfaces. The superior surface, the posterior surface, the inferior surface, the anterior surface, and the two lateral surfaces. This is one lateral surface and this is the other lateral surface. We will begin with the superior surface of the body of the sphenoid bone. The superior surface has the following important structure: ethmoidal spine, jugum sphenoidale, chiasmatic groove, tuberculum sella, middle clinoid processes, sella turcica, the posterior clinoid processes, dorsum sella, petrosal spine, and the interior part of the clivus, ethmoidal spine. This is the ethmoidal spine. The ethmoidal spine is attached to the posterior aspect of the ethmoid bone, as you can see. Number 2. Jugum sphenoidale. This interior horizontal part is the jugum sphenoidale. The jugum sphenoidale, along with some part of the lesser wing of the sphenoid bone, contribute to the floor of the anterior cranial fossa. Number 3. Chiasmatic groove. Posterior to the jugum sphenoidale is present a depression called the chiasmatic groove. The chiasmatic groove is very easy to identify because on both sides it ends into the optic foramen. Here you can see this is the one optic foramen and this is the other optic foramen, and between these two foramen this depression is the chiasmatic groove. Number 4. The tuberculum sella. Along the posterior margin of the chiasmatic groove there is an elevated area called the tuberculum sella. Number 5. The middle clinoid processes. On either side of the tuberculum sella there are two bony elevations and these are called as the middle clinoid processes. Number 6. Sella turcica. Posterior to the tuberculum sella, this saddle-shaped depression is the sella turcica, and in the sella turcica is present the pituitary gland. Number 7. The dorsum sella. This posterior wall of the sella turcica is called the dorsum sella. Number 8. The posterior clinoid processes. On both sides of the dorsum sella, these two processes are called the posterior clinoid processes. Number 9. The petrosal spine. Posterior and lateral to the posterior clinoid processes are present these spines, and these are called as the petrosal spine. Number 10. The interior part of the clivus. In this model you can see that posterior to the dorsum sella is present a continuous slopy surface which is downward and posterior. This slopy surface is called the clivus. Interior part of the clivus is contributed by the sphenoid bone, while the posterior part of the clivus is contributed by the occipital bone. And this interior part of the clivus is present on the superior surface of the body of the sphenoid bone. Now we came to the posterior surface of the body of the sphenoid bone. This is the posterior surface of the body of the sphenoid bone. And as you can see, the posterior surface is attached to the occipital bone via a hyaline cartilage. Next is the inferior surface of the body of the sphenoid. The inferior surface has three main structures: sphenoidal rostrum, sphenoidal concha, and the vaginal process of the medial pterygoid plate. Sphenoidal rostrum. This bony ridge is the sphenoidal rostrum and it is attached to the vomer bone. As you can see in this model, this pink is the vomer bone attached to the rostrum of the sphenoid bone. Number 2. The sphenoidal concha. The sphenoidal conchas are 2 in number, as you can see, and they have a triangular bony plate structure. The sphenoidal conchas are present on the inferior and interior side of the sphenoid body, so they are visible on the anterior and the inferior view. Number 3. The vaginal process of the medial pterygoid plate. This is the vaginal process, and as you can see, it arises from this medial pterygoid plate. That's why it is called the vaginal process of the medial pterygoid plate. Next is the anterior surface. This is the anterior surface of the body of the sphenoid bone. The anterior surface has 4 main structures: sphenoidal crest, sphenoidal concha, rough articular area, and sphenoidal foramen. Number 1. The sphenoidal crest. This is the sphenoidal crest. The sphenoidal crest is attached to the perpendicular plate of the ethmoid bone. As interior to the sphenoid bone is present the ethmoid bone, and both the sphenoidal crest and the perpendicular plate of the ethmoid bone are present in the midline, so they came in contact with each other. Together, the sphenoidal crest and the perpendicular plate of the ethmoid bone will form part of the nasal septum. Number 2. The sphenoidal concha. As I told you before, the sphenoidal conchas are also visible on the anterior surface of the body. Number 3. Rough articular area. These two are the rough articular areas, and they came in contact with the respective labyrinth of the ethmoid bone. Number 4. The sphenoidal foramen. Close to the sphenoidal concha are present the sphenoidal foramen, and through this sphenoidal foramen, the sphenoidal air sinuses open into the nasal cavity. Next is the lateral surface of the body of the sphenoid bone. This is the lateral surface of the body of the sphenoid bone, and to the lateral surface is attached the greater wings of the sphenoid bone and the 2 pterygoid processes. The lateral surface of the body of the sphenoid is very important because it is related to the cavernous sinuses. Over here are present the cavernous sinuses. Inside the sphenoid body are present the 2 sphenoidal air sinuses separated by a bony septum. These sphenoidal air sinuses open through the sphenoidal foramen into the nasal cavity. Now let's move toward the greater wings of the sphenoid bone. There are 2 greater wings having triangular bony plate structure, and they are attached to the lateral surface of the body of the sphenoid. The greater wing has 3 surfaces: the cerebral surface, the lateral surface, and the orbital surface, while it has 2 borders: the squamosal border and the posterior border. Other structures that are present on the greater wings are the spine of sphenoid, the tip of the greater wings, and the rough triangular area. We will begin with the superior surface of the greater wing. This superior surface is also called as the cerebral surface. The cerebral surface of the sphenoid bone and the petrous part of the temporal bone together forms the floor of the middle cranial fossa. There are 3 foramens that are present on the superior surface. Number 1. The foramen rotundum. It is the most anterior and medial of all the foramens. Number 2. Foramen ovale. It is posterior and lateral to the foramen rotundum. Number 3. Foramen spinosum. It is posterior and lateral to the foramen ovale. Sometimes there are 2 more foramens present on the greater wing of the sphenoid bone, and these are the canalis innominatus and imaginary sphenoidal foramen, canalis innominatus. If present, it is on the lateral side of the foramen ovale, imaginary sphenoidal foramen. If this foramen is present, it is on the medial aspect of the foramen ovale. Now we came to the lateral surface of the greater wing. A bony crest is present on the lateral surface, which divides it into upper and the lower part. And it is important to remember it because the upper part forms the floor of the temporal fossa, while the crest and the lower part together form the roof of the infratemporal fossa. We will discuss those in a separate video. Now we came to the orbital surface. This is the orbital surface of the greater wing. This whole green is the sphenoid bone. This is the greater wing of the sphenoid bone, while that is the lesser wing of the sphenoid bone. So this is the orbital surface of the greater wing. The orbital surface of the greater wings has four borders: the lateral border, the superior border, the medial border, and the inferior border. In isolated sphenoidal bone, this is the orbital surface having the lateral border, superior border, medial border, and the inferior border. Among these four borders, the lateral border and the superior border are the articular borders. The lateral border articulate with the zygomatic bone, while the superior border articulate with the frontal bone. The medial and the inferior border are the non-articular borders. They do not articulate with any bone. The space between the medial border of the greater wing and the lesser wing forms the superior orbital fissure, while the space between the inferior border and the maxilla bone, along with some part of the zygomatic bone, will form the inferior orbital fissure. So the medial border has contribution in making the superior orbital fissure, while the inferior border has contribution in making the inferior orbital fissure. Now we came to the borders of the greater wing. There are two borders, the squamosal border and the posterior border. Squamosal border. This is the squamosal border, and as you can see, the squamosal border articulates with the temporal bone. Number 2. The posterior border. The posterior border, we divide it into two, the medial side and the lateral side. The medial side of the posterior border is non-articular and contribute in the formation of the foramen lacerum, as you can see, while the lateral side of the posterior border articulate with the temporal bone. On the greater wing of the sphenoid bone, there are three more structures: the tip of the greater wing, the rough triangular area, and the spine of the sphenoid bone. Tip of the greater wing. This is the tip of the greater wing. In a complete skull model, this is the tip of the greater wing. And as you can see, it came in contact with three bones: the frontal bone, the parietal bone, and the squamous part of the temporal bone. Next is the rough triangular area. Medial to the tip of the greater wing, this is the rough triangular area. And this rough articular area came in contact with the frontal bone. This is the frontal bone, and in the inferior view, you can see this rough triangular area. The rough triangular area of the sphenoid bone and the frontal bone came in contact with each other. You can see in this model, the two rough triangular areas come in contact with each other. Next is the spine of the sphenoid. This is the spine of sphenoid located at the junction of posterior border and squamosal border. Next is the lesser wing of the sphenoid bone. This triangular bony plate structure is the lesser wing of the sphenoid bone, and it is attached to the anterior and superior part of the body of the sphenoid. In the lesser wing is present the optic canal. This is the optic canal. On the lesser wing are present two borders and two surfaces. The two borders are the anterior border and posterior border, and the two surfaces are the superior surface and the inferior surface. First, we will discuss the borders. Interior border. This is the interior border of the lesser wing, and as you can see, it is attached to the orbital part of the frontal bone. The posterior border. The posterior border of the lesser wing is sharp and it is free. It is not attached to any bone, and it forms the boundary between the anterior cranial fossa and the middle cranial fossa. Posteriorly, this border will form the interior clinoid processes. Now we came to the two surfaces of the lesser wing. First one is the superior surface. This is the superior surface of the lesser wing. The superior surface is smooth and continuous with the orbital plate of the frontal bone. And it is this superior surface of the lesser wing that has contribution in the interior cranial fossa. Next is the inferior surface of the lesser wing. The inferior surface of the lesser wing will form the innermost part of the roof of the orbital cavity. This green is the sphenoid bone, and as you can see, this innermost roof of the orbital cavity is formed by the inferior surface of the lesser wing. Next is the pterygoid processes. There are two pterygoid processes located interiorly and inferiorly to the body. We will take one pterygoid process as a representative. The pterygoid process is split into the medial pterygoid plate and the lateral pterygoid plate. Posteriorly, between the medial and the lateral pterygoid plate is present the pterygoid fossa. In complete skull model, this is the medial pterygoid plate and this is the lateral pterygoid plate. And between these two is present the pterygoid fossa. Interiorly, in the upper part, the medial and the lateral pterygoid plate are fused together, while in the lower part, they are separated by a pterygoid fissure. This pterygoid fissure is filled by the pyramidal process of the palatine bone. This green is the sphenoid bone. This is the lateral pterygoid plate, while this is the medial pterygoid plate. And between these two, the pterygoid fissure is filled by the palatine bone. Now when you see the posterior view, then it is clear that in the pterygoid fossa, the palatine bone has also contribution. This green is the palatine bone contributing to the pterygoid fossa. The medial and lateral pterygoid plates are very easy to understand. Both of them has two borders and two surfaces. This is the interior border of the medial pterygoid plate and this is the interior border of the lateral pterygoid plate. Same. This is the posterior border of the medial pterygoid plate and this is the posterior border of the lateral pterygoid plate. And the two surfaces are the medial surface and the lateral surface. This is the lateral surface of the medial pterygoid plate, while this is the lateral surface of the lateral pterygoid plate. Same. This is the medial surface of the medial pterygoid plate, and this is the medial surface of the lateral pterygoid plate. We will begin with the lateral pterygoid plate. First, we will discuss the borders. This is the interior border of the lateral pterygoid plate, and it is a free border. It does not articulate with any bone. As you can see in this diagram, the interior border of the lateral pterygoid plate is free. Next is the posterior border of the lateral pterygoid plate. This is the posterior border of the lateral pterygoid plate, and as you can see, the posterior border is also a free border. It is not attached to any bone. Also, a bony process is present on the posterior border. Next are the surfaces. This is the lateral surface of the lateral pterygoid plate. Number 2, the medial surface. This is the medial surface of the lateral pterygoid plate. Now we came to the medial pterygoid plate. The interior border of the medial pterygoid plate is attached to the perpendicular plate of the palatine bone. As you can see in this model, this green is the sphenoid bone. This is the interior border of the medial pterygoid plate, and as you can see, it is attached to the perpendicular plate of the palatine bone. Next is the posterior border of the medial pterygoid plate. The posterior border is also a free border. As you can see, this is the posterior border of the medial pterygoid plate, and it is not attached to any bone. In the lower part, the posterior border shows a hook-like bony spike called the pterygoid Humulus. Next is the medial surface of the medial pterygoid plate. This is the medial surface of the medial pterygoid plate. The lateral surface of the medial pterygoid plate. This is the lateral surface of the medial pterygoid plate. That's all about the sphenoid bone. Thank you.